Hi, my name is Monique Boudreau, and welcome to the Advantage Workshop, where we bring you conversations with experts who are shaping the future of healthcare. In this episode, we're shining a light on the incredible work of the Walk Strong Foundation, a nonprofit dedicated to providing sustainable total joint replacement programs in underserved communities around the world. Founded by Dr. Michael Christie, Walk Strong is transforming lives by equipping local healthcare teams with the education, training, and resources needed to perform life-changing orthopedic surgeries. Join us today as we explore how this mission is creating lasting impact, restoring mobility, and giving patients a second chance at an active life. Dr. Christie, thank you so much for joining me today.
Great to be here. Thank you.
Yeah. So here's my first question. As the founder of Walk Strong Foundation, what inspired you to take on this mission, and how has the foundation evolved over the years?
It's a big question. I'm a joint replacement surgeon. Been doing it for a very long time. I have the best job in the world. I get to do this amazing operation that takes away the pain of walking and moving. You know, knee replacement, hip replacement. If we look at the three operations that the National Institutes of Health say have the greatest impact on patients' lives, number one is cataract surgery. The lovely thing about cataract surgery is you go in, you can't see, and 20 minutes later, you can see. And then hip and knee replacement. Hip and knee replacement take away the pain of an arthritic joint by putting metal and plastic caps over the ends of the bone. And it is an instant relief of the bone rubbing on bone pain. The patients do remarkably well, returning to active lives. So I get to do this fun operation. We get more hugs per clinic than any other medical specialty. I get to use power tools in the operating room, which is also fun. And so the trouble with joint replacement is that it's a really expensive operation. Your audience, I think, knows that the amount, it is the most equipment intensive procedure that we do in modern operating rooms. So pans and pans of instruments. The implants themselves are exorbitantly expensive. We're talking about $5,000 for a knee replacement, about the same for a hip replacement. Even huge hospital companies that have great power in buying can't negotiate those implant costs down below $3,500 to $4,000. If we look at the rest of the world, and we're talking now about low and middle income countries. The definition of a low income country is an annual income of $1,100. Middle income is a little over $4,000. At $1,100, that family is getting $3 a day. And so if just the implant, not the operation, costs $5,000, it might as well be $5 million, because that family, that person, could never ever have enough money to be able to have that surgery. So in many places, there's some government hospitals, there are some charitable, either Christian hospitals or private hospitals that provide these surgeries, but rarely, because they are so expensive. In the past, and when we started Walk Strong, most of these surgeries were done as mission trips. So what I mean by mission trip is a group of surgeons and staff gather up medical equipment, go to a site, a hospital in a low and middle income country, and bring that equipment, bring donated implants, because the implants are so expensive. The implant companies donate 25 or 50 hip or knee replacements. They go there for a week and they do a bunch of knee replacements, and then they gather their stuff up and they leave. Presumably, those patients all do well. But if you don't go back and if you don't track those patients, how do you know? Did the patient have an infection? Did they have a pulmonary embolus? Did they have some complication from their hip or knee surgery, a dislocation, an implant that wasn't working well? So Walk Strong actually started as a mission trip model implant, our mission company, because of the cost of the implants. Now, we decided we were going to do it a little bit differently at the beginning. We said, okay, let's try to go multiple times to the same place per year so we can track our patients and see the outcomes of our surgery. And then let's make a 10-year commitment that we're going to go back every year for 10 years. We follow our patients for life because mechanical things in a human body wear out. While they continue to perform much better than they did 30 years ago, they still wear out. So we do revision surgeries and treat infections and those kind of things. If you're not going back to that original site, then who's going to take care of those patients?
Right, right.
So, as we got experience, we said, let's train people there. Well, if you're going 2 or 3 times a year, if you think about it taking 6 years to make a joint replacement surgeon, going a couple weeks a year is not going to make a joint replacement surgeon. So we then decided to bring one of these young doctors that we met in Mexico to come up and spend a year with us. We have a fellowship where a graduated orthopedic surgeon spends a year training with us. This is that whole idea of, give a man a fish, feed him for a day, teach him to fish, you feed him for a lifetime,
Mm-hmm.
right?
Mm-hmm.
The old Chinese proverb. Unfortunately, it really isn't completely true. Because if you think about it, if you teach a guy to fish, but he doesn't have a fishing rod or a net, he has a useless skill.
Right.
Okay. So, training people to do joint replacement when nobody can afford it it's like having an electric charger for an electric car and you don't have an electric car.
Right.
It would be pointless. So we looked at things and said, okay, what are the barriers to doing hip and knee replacements in these countries? Number one, as we've already talked about, was the high cost of the implants. And if we could not find a way to get implant prices down at a reasonable level, then none of the other barriers would be surmountable. I spent literally decades talking to orthopedic companies about this kind of a project. And most would be interested. And then as they looked at things, I said, give us last year's model or the one from 5 years ago. That's going to be better than nothing. A lot
Mm-hmm.
better, actually. And we just couldn't get traction. Finally, 5 years ago, I met with the CEO of a very small but active orthopedic company in Sydney, Australia. It's called Signature Orthopedics. And I had that same conversation at the end of dinner. And, can we do a inexpensive FDA approved implant? And Declan Brazil is the CEO and owner said, yeah, let's do it. And literally 18 months later, we had the World Knee. The World Knee is a knee that I can use in my own patients, and I do. It's FDA approved. And the critical thing about the World Knee is it is a $500 knee, not a $5,000 knee. Completely changes the conversation, right? Because now, either they can raise money locally, or we can raise money in the U.S. to buy them. The average joint replacement mission trip model for you to go for a week is $250,000. Think about how many $500 knees I can buy for $250,000.
Right.
It's a lot of people who are going to be walking again. And we realized we also had to address the hip side. Hips are a little more complicated in terms of number of parts, and we worked with Signature to design a hip, actually on an airplane ride back from one of our national meetings. And 2 years ago, we now have the World Hip, call them World Hip and World Knee. World Hip is $800, and it is as good as any hip made by any manufacturer in the world.
So
So
what is the difference between the $5,000 knee and the $500 knee? Right?
uh,
Right?
profit, middlemen, right? So there's a lot of people, sales staff, distribution staff, marketing, all those things are layers, right? So the chair that you get for your apartment that is $1,000 was really less than $100 to make in Vietnam or China.
Hmm.
By the time it goes through all those layers, it becomes tremendously more expensive. What that meant was essentially that Signature said, we're going to, we don't want charity. And charity is a wonderful thing, but people eventually run out of charity. It puts great pressure on the donor, and ultimately it runs out. So you've got to make a model sustainable. You can't rely on gifts. In the sense that we need to have an implant gifted to us. When we have affordable implants, then suddenly we can start looking at this bigger problem, the teaching the man the fish. So to be able to do joint replacements, we need to have well-trained surgeons, but we need anesthesia, we need scrub nurses, we need central sterile people that is the heart and soul of every hospital is instrument processing and central sterile. If it's not good, nothing in that hospital is good. So we have to make sure they have adequate equipment, adequate training. So we bring people who are skilled in those things. If we think back to what we were originally talking about, and I'm sorry if I'm waterboarding you here, but
Not at all.
if you look at the average room where they're doing a hip or knee replacement, there are going to be 20 pans of instruments. If we go to one of the hospitals that we go to in Africa or Latin America, the sterilizers are not these big run a cart into them through the washer. They are things that you might see at a surgery center or a dental office. A lot of them are dental sterilizers. So they're small. And if you're going to try to run 20 pans through that, you're going to do one operation a week. So we designed the instruments to be a lot more Spartan. Did everything that we need to do to do a great joint replacement, but we removed a lot of the instruments that are more surgeon specific. So it ended up being 2 pans for the knee replacement and 3 pans for the hip replacement. And instead of $70,000 cost for instruments, so if you're going to do 5 knee replacements in a day, you're going to need either 5 sets of instruments or a really great central sterile that they can turn over instruments. So those 5 sets are $70,000 for a set of instruments. By going to a more Spartan but efficient instrument set, they're $17,000. So we can equip a hospital to do multiple hip or knee replacements in a day without breaking the bank. So the implants are not crazy expensive, and the instruments needed to put a hip or knee replacement in are not crazy expensive. They're affordable. We have found as we worked across the world that there are a lot of surgeons who were trained to do joint replacement. So someone taught them how to fish, but they didn't have the equipment. So once we have the implants and we start doing the training, what else do we need? We need better sterilizers. We need OR tables. We need lights. We need suture. We need the drapes. I mean, it's crazy how much
Right.
stuff goes into doing a hip or knee replacement effectively. And so we partnered with a big nonprofit called Project Cure. Project Cure has 6 warehouses across the United States where they collect medical equipment, either used medical equipment from hospitals or surplus equipment or last year's model. They have these 70,000 square foot warehouses where they collate this stuff, and for $45,000 they will send a 50-foot shipping container full of medical equipment to one of these hospitals. They go and do an assessment, and if we need 4 OR tables and a set of lights and some baby incubators, birthing equipment, they put all that and ship it. So they get the equipment free. It's the cost of shipping that is the $45,000. So we've used them to help us equip the hospitals. So we go through those barriers. Number 1, implants. Number 2, surgeon staff training. Number 3, infrastructure. Okay, equipment needed to be able to do this surgery. And the final and ultimately the most important one is, well, how did things turn out? Did you accomplish what you thought? And you have to do that by tracking outcomes. So Signature designed a smartphone-based total joint registry outcomes demographic program that basically the site can use the barcode on the implant box to load that in, load the patient demographics, and then track outcomes like surgical complications, patient reported outcomes like how far can I walk, how many steps can I climb, those kind of things, which are really critical if we're going to actually do what we think we're going to do. We have to know, we have to measure. I remember a story talking to a surgeon who had done a mission trip in Kenya. Africa is one of those places that you either hate it or you fall in love with it. He fell in love with the country and went back 3 years later. And they said, "We're so happy to see you. We really appreciated that you came with the big group 3 years ago, but please don't come back." And he said, "I don't understand." They said, "Well, you had a 30% infection rate. Our local population thought that we were not good enough doctors because we weren't American. You took over our hospital for a week and we couldn't treat our patients. And our patients were expecting free care." So the impact of the mission trip on the local surgeons, doctors, and hospitals have to really be factored into the project. So to me, to Walk Strong, the SMART plan becomes, let's empower the local doctors to do this surgery. Let's train them. Let's give them the equipment, the methods to measure how they're doing, and they can treat patients 365 days a year. It's not somebody flying in 101st Airborne, parachuting down, doing a bunch of joint replacements for a week and leaving. That becomes more about the mission trip people than the patients that they're treating. Right? It's
Right.
a emotionally amazing thing to actually go help people like that. But that's not the real. How you feel is great, but that's not the key. So that's been our change. And if you said, okay, it sounds good. You've been doing this for a while. Is it really working, or are you just BSing us? We now have a great hospital in Honduras, a well-trained, U.S.-trained joint replacement surgeon who decided to go back to Honduras and help the people of his country. He is doing knee replacements weekly. He and I have just submitted a paper on his outcomes, which have been as good as the ones that we have here in Nashville, Tennessee. We've got 4 hospitals in Africa. Of those, the goal was become self-sustaining. What does that mean? That means that that we in the U.S. are not buying implants and sending them to you. You've figured out a way, either through the support of the country or support of the donors that support your hospital, to buy these implants at cost, in essence. And of those 4 hospitals, 3 currently are, actually all 4 are now self-sustaining, meaning they're buying the implants. We're still going back because we're there to train and teach and evaluate and help. But the goal is that we become friends and visitors, not providers. So it's working.
Right. Well, that's fabulous. I loved hearing about that.
Yeah, no,
Yeah, take a
it's
break.
an amazing project.
It's
We're all
fantastic.
volunteer. We got these amazing people who bought in and go on the trips with us, doctors and nurses. My staff here, Walk Strong staff in Nashville, are entirely volunteer. So there's
Right,
no overhead that is not either sending people or buying implants.
right. So what's next for Walk Strong then? Is there anything, any new initiatives or expansions that you're excited
But
about?
the if you think about it, in the U.S. Per year, there are about 3 million joint replacements done. That's in a country of a little over 300 million people. The world is 8 billion people, plus or minus, right now, most of which are low and middle income countries. If you have advanced osteoarthritis in most places in Africa, you are not going to catch a bus. You're not going to drive your family car somewhere. You're going to walk. And if you can't walk, now you can't work, and your family has to support you. So, if we look at the cases, we're going to Eswatini. It's a small country in Africa, next week after next, and we've been reviewing those cases. It's all neglected arthritis, so it's the worst of the worst. Training a bunch of doctors. We've got a couple guys coming down from Tenwick in Kenya, one from Cameroon, and then their local surgeon will be doing cases together so they can take that experience back to their home hospitals and do world knee and world hips there. So
That's exciting.
we're gonna grow. Our biggest problem is going to be keeping up with the cost to buy equipment, finding ways to continue to build the inventory of joint replacements. We've been primarily talking about primary or first-time surgeries. Many of these neglected arthritis cases require revision implants. So we're designing some revision implants. There are cheap implants available in the world, but they're made in China and Pakistan and India, and they're not used in most the low and middle income countries because they break. And if you take a person with an arthritic hip who is barely getting around, put in an implant that then breaks, you've now made him worse than he was because he can't work around a broken implant. So we have to be able to solve those problems too.
Right.
We're going to be working with HCA and hopefully getting some of the companies like Medline and Johnson & Johnson and Ethicon to embrace the idea of not charity, but providing the necessary equipment at close to cost. The hip replacement, this is a world hip right here, it's got a ceramic head ball. That is, if you were to drop it on the floor and have to open another box, is $800. So that's the entire cost of this implant. The company that makes this is a company called CoorsTek. CoorsTek is part of the Coors family of companies, like Coors Beer. They provide these ceramic head balls at cost, which is obviously has to be pretty inexpensive if we can include it in an $800 implant. So working with more companies like that who are, again, if they're not losing money, it is a more reasonable proposition for them. And hopefully that will allow this project to expand even further. And there's no shortage of people with arthritis.
Right. Right. Absolutely. So with, Walk Strong's mission to provide these surgeries, but not just provide the surgery, create long-term sustainable programs through your education and training. How do you ensure that those local healthcare teams are empowered to continue that work after you guys leave?
Well, I mean, we're not going if we don't have the support of the local surgeons. Most of where we go, there's no shortage of interest in being able to do these operations because they see patients like this every day, and they just simply have not been able to help them because there was nothing that could be affordable. In Kenya, for instance, there is a family health insurance program available that is $75 a year. So in the realm of possibility, if you are, making $1,100, consider it kind of like our Medicaid or Medicare. The Kenyan government reimburses the hospital if they do a hip or knee replacement about $1,200. So if we have a $500 knee replacement, suddenly what was instead of a $5,000 knee replacement, $5,000, you're losing, about $4,000. With a $500 knee replacement, suddenly you're making $700. And now the hospital can start to do joint replacements and use that surplus to fund their neonatal intensive care unit or build new ORs or child maternal health division, whatever. They get to decide what they can use that money for. But we become a revenue center instead of a cost center. Not all countries are that way, but we really have to adjust the model a little bit for each and different place we go to.
Right. Wow, that's exciting. So for anyone who's listening and wants to support Walk Strong or just find out what your foundation's work is doing, how can they find you?
WalkStrongFoundation.org. So we've got a
All right.
great webpage. We're on social media, so again, stuff I couldn't find if I had a gun at my head. But Facebook, LinkedIn, and Instagram all have sites. As I said, we're going to Eswatini. Eswatini is Swaziland. It's a country completely landlocked in the northeast part of South Africa. So we're talking Southern Africa, the country of South Africa. Eswatini is a little country inside. Eswatini is Swaziland in the Swazi language. They changed the name of country from the English version to the Swazi version.
Okay.
And we'll be sending lots of photos and videos there. One of my partners just got back from Cameroon. That was an initial trip there, doing knee replacements, training doctors there. And that stuff's available on the website as well.
Excellent. Thank you so much, Dr. Christie, for sharing that with us today. And it's incredible work what the Walk Strong Foundation is doing. So I just love getting your name out there more, and send us pictures and videos, and we'll post them on our website and everything, and
That's
our social
great.
media.
Yeah.
Definitely. Um, that's it for today's episode of the Advantage Workshop. If you enjoyed this conversation, don't forget to follow, leave a comment, or share with one of your colleagues. I'm Monique Boudreau, and have a great day.